The power to heal. The future of pain relief.
It is well known that diseases like diabetes, high blood pressure, and other illnesses may restrict blood flow, which can lead to impotence and erectile dysfunction. This is why Enhance was formulated to meet these challenging health problems, which can reduce your ability to perform. If you're having problems maintaining your manhood, then reclaim your manhood today with Enhance. Enhance increases your energy level, boosts your stamina, and increases your endurance.
You can get your Enhance at Southwell VA4, Restorer Pharmacy Soufre, Knights Med Miku, Lay by Bar The Morn, Dexter's Place Jeremy Street Castries, Citygate Bar The City opposite the market, Plants Place Denry Highway, Arlette Supermarket Soufre, The Release Stress Bar Labrie Highway, Cool Joint Bar Victoria Schwazel, Prios Bus Stop 22, next to the Moshi Bus Stop opposite the Grosile Bus Stop, Prios Bar and Grill in Corinth, Grosile.
Enhance, the best a man can get.
Live streaming has become one of the best ways to connect the funeral of a loved one with friends and family, both local and international. NBC Television will live stream your funerals on television and Facebook at a reasonable rate. With our state-of-the-art equipment, you can be assured that the quality of your funeral will be to your satisfaction. Call our office now and book your obituary and streaming with us. 758-453-7458.
Why are you suffering from aches, pains and illnesses? When there's help for you. At Health Service Center, we offer a wide range of treatment that has been scientifically proven to help you with your aches, pains and illnesses. Our ICT machine is one of the most effective devices in the health field. It has shown positive results in many health problems such as back pains, shoulder pains, migraine headaches, pain in the knees and legs, poor circulation, arthritis, diabetic neuropathy, numbness in the feet, strokes and sports injuries. ICT, repairs, rebuild. The power to heal. The future of pain relief.
Good morning and welcome to PHI, that is Public Health Insider. I am Jade Brown and today we will be discussing, or we're focusing on universal health coverage and matters pertaining to universal health coverage. So thank you for joining us this morning. And I say us because I have an esteemed guest with me as usual. Today, this is Acting Assistant Principal Nursing Officer, we say PNO, Persia Ajuda. Welcome to the show.
Thank you.
Okay, we're very happy to have you on with us. I know that we contacted you late yesterday, but we're very happy that you were able to accommodate us because we know that this is an important topic, what we'll be discussing today.
Yes. So good morning to you, Jade Brown, and good morning, St. Lucia. It is a pleasure to be here. And thank you for the opportunity to share and to speak on breastfeeding.
Of course, of course.
Jade, August is breastfeeding month. So in August, we promote breastfeeding, and throughout the years, we promote breastfeeding because breastfeeding is critical to the health of our nation, health of the infants, health of the mothers, and health of St. Lucia. So for this month, August 2024, our theme is Closing the Gap, Breastfeeding Support for All. Breastfeeding is critical, and I want to emphasize very, very critical. And WHO and UNICEF have launched the Baby Friendly Initiative in 1991. And we may ask, why BFHI? In short, it is BFHI. It is because WHO has established that exclusive breastfeeding and breastfeeding up until at least 2 years and beyond is very critical and very essential to the health of the infant.
Okay.
And exclusive breastfeeding, which is breastfeeding, giving your infant breast milk alone, no water, no solids, except medication for the first 6 months, is very critical. And it is the largest potential impact on child mortality and morbidity. Plainly to say that exclusive breastfeeding can reduce a child's health condition, negative impact, and reduce mortality in terms of the child's death.
Okay.
So I would love to say this maybe in Creole. Let me attempt to do
Okay.
so. So someone can say di law by issue let tete. It can affect or it can impact issue et puis can impact maman. Et puis by issue let tete tout seul pour 6 mois. C'est yon bagay sou ni pou gade just ça tout seul. Il y a un grand impact à souti maman là dans manière la kay profiter et manière il kay fair in terms of healthily as in
Okay.
overall.
Okay. So I think that covers also why it was established. Is there a reason why WHO established this campaign? Did they see a lack in this area? Do you see a lack in this area in St. Lucia?
Certainly. So we have seen when we look at breastfeeding, in as much as we discuss the impact of breastfeeding and how effective it is in worldwide, and we do recognize that WHO has also established that over the years, about 800,000 persons or infants have been impacted in terms of reduction of mortality and also general health. We do recognize that the rate of exclusive breastfeeding is not, essentially it is not high.
Okay.
So WHO has launched this initiative where we are trying to promote a baby-friendly hospital, where within the hospital setting, we advocate for exclusive breastfeeding. There will be no visible teats in terms of bottles and no formula feeding, but we promote exclusive breastfeeding. With this, we have started education with St. Jude Hospital, who is well on their way to baby-friendly hospital. And so there has been training in the past, in last year. And yesterday we conducted a workshop at St. Jude Hospital with mothers to promote exclusive breastfeeding.
Okay. So what level of training would go into the healthcare practitioners? How would you approach that topic with them, and how would you ensure that they are well equipped to support the mothers?
So what we ventured to do is to educate our healthcare providers. We do recognize that education is paramount, and with education there is a change in action. So, of course, nurses are trained in breastfeeding at our nursing schools, but we do go forward and we do extensive training with the nurses. We also did training with the doctors. And with the BFHI initiative, every single person at the health facility would be trained, but at different levels. Okay. So the handyman, the health attendant, every single person would be trained. And why is that critical? This is critical because we want everyone to be on board. Again, breastfeeding is about everybody. So with this initiative, as there will be evaluators, of course, so as persons come in and evaluate, every single person should have a certain level of knowledge of breastfeeding.
Ah, I see. Okay, and how has that gone so far? How has the training been received on the part of from the perspective of the health practitioner?
Well received. It has been well received, and we are seeing some changes, and of course this is continuous, Jade. And I really want to mention that aspect. It is continuous, and of course when we do hopefully get to the status of BFHI certified, it has to be continuous. We need to continue to promote breastfeeding, continue to do the right things. Yes.
Okay. So, for you would say that a baby-friendly hospital would mean that there's exclusive breastfeeding throughout?
This is what we promote.
Okay.
We do recognize that there are exceptions where persons are not able to breastfeed exclusively. There may be medical conditions that we won't go into right now, but generally at a BFHI, baby-friendly hospital, exclusive breastfeeding is promoted.
Okay. So, what are some of the main concerns of health practitioners as it pertains to breastfeeding?
Yes, so this is a very good question, and we do face some challenges, and we do have some concerns as it relates to breastfeeding. There are certain cultural barriers and myths that exist, and where persons believe that the breast is not enough, the breast milk is not enough, it is not adequate for the child, that the breast milk will turn, and I would say that in patois, lactate kaitune, and the breast is in the milk, but some persons believe it will turn and it goes bad. Mm-hmm. And we do have the issue of the lack of support of generally in terms of parents, partners at the workplaces. We do recognize that maternity leave and paternity leave is very critical to support exclusive breastfeeding. And so we do, this is an area that we really want to emphasize on, that persons who need time to breastfeed. So workplaces, making the places conducive for persons to breastfeed. Are there places where persons can go to a room comfortably and pump the breast milk?
Right.
Can someone feed the baby in a room which is conducive and quiet and comfortable? We also view also the society in terms of perceptions, and some mothers would give feedback in terms of the perceptions of the society as they breastfeed, maybe on a public bus. So all those things are critical, and of course as we conduct our teaching and our education, we promote it and we address those myths and those issues.
Okay. How do you encourage women to breastfeed while maintaining healthy relations with them?
Okay, very, very critical is to educate, and as I said earlier on, education is critical. It is very, very important. When we know, we most likely would do. But we do recognize, again, as I mentioned, the myths, so we would have to address the myths. We try to encourage involvement of the family, social support, the entire group. So we try to promote as well that the mother needs the partner, the mother needs the family, the mother needs the society. We also want to look at social groups as well. So we want to focus also, we are focusing very largely on antenatal care within the facilities, within the wellness centers, where we do aggressive health education about breastfeeding, care of the breast, preparation for breastfeeding, and encouraging persons to make the decision to breastfeed and to breastfeed exclusively. And also postnatally, as persons return to us, we also further emphasize that as well, and also to be able to provide support to them as well. One of the things I would say is lacking is the social groups within the different regions and communities, which we are working on, and we do hope that we can establish groups that mothers can go to and be part of and feel welcome, to feel support within the process of breastfeeding. Breastfeeding is challenging. Breastfeeding is not easy, it is challenging, but indeed it is beneficial. It is beneficial. There is evidence to support breastfeeding.
Okay. How would you go about, or how has the Ministry of Health gone about equipping healthcare workers with the soft skills that is so desperately needed when approaching a mother who, has gone through childbirth, which for many people, it's quite a traumatic event, or a life-changing event, I should say. How has the ministry encouraged the healthcare practitioners with those to utilize those softer skills at that stage?
Okay, very good question. So we do recognize that persons do have choices. Breastfeeding is a choice. Essentially, it is a choice. However, we do encourage persons to breastfeed exclusively, recognizing the benefits of breastfeeding to the child, to the mother, to society. So we encourage persons to be non-judgmental, of course, as we approach mothers. We also encourage healthcare providers to be patient, to follow through, to recognize that we all may approach things differently. We may have healthcare providers who may have a baby. I have 2 boys, and for me, I was a midwife already, and it was challenging. So being able to empathize with persons and to take them through step by step, to be available where persons can call in and persons can receive help, where we can also within a community we do home visits where we can go and we do the breastfeeding support with mothers as well.
So for a young mother or any mother of any age, if they are struggling, what is the best point of call? How would they approach that? Who do they call? Where do they go?
Okay, so as I said, antenatally, mothers would have access antenatal care at a facility and establish a rapport with the healthcare provider. Okay. And in the community, this is excellent. The rapport is good, and so they are aware that there is a midwife who I can go to. And so if there are concerns, they can call in. They can also walk in and seek attention. Whilst at home, there may be a community health aide who may visit them or access their homes, and there could be communication also through the community health aide to the nurse, or calls can be made. So what we're saying that the facilities are accessible, and so persons can access care and they can access help.
Okay, that's excellent. Just a note to our viewers and our listeners, we are accepting calls now with Public Health Insider. You can call with your queries, comments, or questions at 453-3911. You can make that call to make a contribution anytime from now. If you have a question or if you have a comment, if there's something you'd like to say, you can do so by calling 453-3911. The discussion today is on breastfeeding. Now, how does this tie into universal health coverage?
Yes, so we did mention in terms of exclusive breastfeeding and infant mortality. So we look at maternal and child health, which is very critical and ties in very well with UHC.
Right.
Exclusive breastfeeding supports the Sustainable Developmental Goals 3 and 1. And 1, which is to, of course, reduce or stop poverty, and 3, to ensure healthy lives and promote well-being for all ages. And as we see, UHC and also maternal child health promotes the healthcare for all. And so this is very critical and ties in very well. And of course, I really want to go back to the point that it reduces infant mortality and promotes the health of the infant.
When you look at our society, would you say that women have a full understanding of breastfeeding, its benefits, or the lack of breastfeeding, and what difficulties the babies might go through if they don't have that exclusive breastfeeding? Do you think that our people are well informed?
I would say persons are aware, and however they do require, for some persons who require increased knowledge, increased information about breastfeeding. As we go throughout our facilities and we promote breastfeeding, there are perceptions that are clarified. There are persons who would indicate that they are not fully aware of certain benefits of exclusive breastfeeding. And we have so many benefits of exclusive breastfeeding, and we simply common one, we know that generally lots of parents would love that their children would be intelligent and be smart, and this is exclusive breastfeeding contributes to intelligence very, very, very much so. And also in terms of weight loss, I know women are concerned about the weight that they put on during pregnancy, and this is a free weight loss regime. It is free, and you can lose weight very well with breastfeeding. And we also see the health of the child, of course, would really be promoted, and so with that ties in the low absenteeism in terms of mothers at work, and also this ties in with the economy. So we see it's a holistic, the benefits are holistic. It's very, yes.
Okay, so if a mother is exclusively breastfeeding, then of course you'd encourage them to pump.
So yes, so with exclusive breastfeeding, again, only breast milk. So persons are encouraged to breastfeed, and we call it responsive breastfeeding.
Okay.
So you respond to the child. So there is no timing. Give the baby breast milk within 1 hour, 4 hours. No, there is no timing. Responsive. So the baby would speak to the mother, and there are cues for hunger cues. So a mother is to identify and to be able to know the hunger cues and to be able to feed the baby before the baby reaches the stage of very hungry, where the child sometimes is hysterical and crying and sometimes may not take the breast at this time.
Alright.
So when the child has a closed face and sometimes sucking on the finger, searching for the breast, these are signs, mommy, I'm hungry. And so you feed them. Yes.
So what are some of the other signs that you would say to somebody to look out for?
So generally these are the signs, but if a child then starts to get very fidgety and very and crying, these are the late. Then this would be the later signs.
Oh, okay.
So those I mentioned earlier would be the earlier signs of hunger.
Okay, so there's
Yes.
responsive breastfeeding, and if the mother then has to transition back into the workforce, because we know that is at about the 3-month mark or even less for some women who've taken time before they give birth, how would you encourage that transition to go on smoothly?
Very good question. And so through our interactions with mothers, we have realized that one of the major reasons or determinants of breastfeeding, exclusive breastfeeding, would be that of going back to work and having to work. So you find mothers would respond and indicate that I will introduce a formula to prepare the infant so that I can be ready to go back to work. However, I would say to us, to Senusha, persons who are breastfeeding, it does not have to be so. So we can pump. Mothers can start pumping very early. 92% start pumping very early because as the baby grows, the babies would consume more milk. Okay, so then you would have a storage of milk that as you return to work, baby can consume that milk. So you continue and you set a momentum and you express regularly around the same time, and you will realize that your breast milk production will increase. So this is how it is made, and so as you breastfeed, there are hormones that are related to this. Prolactin and oxytocin is the let down, and prolactin with the production, and so more milk is being produced. The more you breastfeed, the more milk is being produced.
Okay.
So if a mother pauses and does not breastfeed or cease from breastfeeding, she will realize there will be a decrease in supply.
Okay, so if we have to break this down, because I also recently had a baby, and the interactions with women, particularly young women, and it will be their first time having a baby, sometimes it's not very positive. The feedback that they would give, not necessarily on the healthcare providers' end, but in terms of their knowledge. So it would be little things like the nipple cracking, or what to do if that happens, or they expect that there will be a little pain or a little discomfort on the first few times. How would you break down the breastfeeding process for somebody? Because so often throughout the birth process and breastfeeding, people would say, I wish I knew this. It could be the simplest thing, but how would you approach a new mother with this breastfeeding campaign?
Yes, so I would say to the new mother, it works. The decision to breastfeed is very critical. First of all, to decide to breastfeed. I would say also to the mother that it is beneficial, but it is challenging. So make up your mind to do so. Being relaxed is very important. If a mother is not relaxed, then it affects the letdown of the milk. Okay. Also, I would say to them, take it one day at a time and think positive. Think positively, recognizing the end product of that. It is challenging. There may be sleepless nights because generally babies feed a lot more during the night. So condition the mind that and expect those things, but also keep the big picture in mind. A healthy baby. And also we would also go through the process of breastfeeding. Okay, but I would also indicate in terms of the nutrition is also critical. eat well, take care of yourself.
What's
It's a
about
balanced meal.
Sorry to chime in here, but what about the old wives' tales like eat saltfish or cocoa tea?
Yes, those things are these things are being said, and for some persons it works, and for the saltfish I would probably say, because of the salt in there generally, then you'd increase your water consumption, because with water consumption, this is a very important point. When breastfeeding, water intake is very critical. So you drink large amounts of water. So of course I would encourage the mother, you sit down, you relax, think of something beautiful. This is your moment with your baby. Have your baby, your beautiful baby that you've worked hard for. Now you have your baby. Sit down, talk to that baby, drink some water, relax. Of course you ensure that the breast is clean properly, the nipple is clean with a wet rag. You position your baby and you speak to your baby and hold baby, ensure that baby is latched on properly. You spoke about the cracked nipples, Jade. This is a common discomfort that mothers speak about, and most times this is attributable to the latch on. So I would say to the mother, ensure that the baby is latched on properly. So we have what we call the areola, which is the dark part around the nipple. So as much of this part should be in the baby's mouth. Okay. But we do recognize that some of the areolas may be large, and so not all of it will be able to be in the baby's mouth.
Okay.
Okay.
And what advice would you give to women who have, so many of them? A friend of mine just had a baby and she has inverted nip. I know that causes a lot of not discomfort, but difficulties, I would say, for the latch.
Challenges, yes. So with the inverted nipple, of course, antenatally, this would be recognized. Okay. So from there, the nurse would start educating her and teaching her. And postnatally, then you could start pulling this nipple out. We have methods that we use. We have the syringe that we can use, where the syringe is cut and the plunger is turned and it is pulled out. This is a technique. Also, the simple act of breastfeeding can help the nipple protrude a little, and also we have the pumping also can also help as well.
And in terms of pumping and storage of milk, how would you advise a mother to store her milk and ensure that in terms of shelf life, how do you educate on that? Okay,
so the storage of the breast milk. So mothers can express breast milk, and it can be stored in a freezer for at least 6 months. Okay. Yes, and we do encourage persons, of course, first in, first out. So you save your breast milk. Also, we encourage persons in terms of the storage that you don't waste your breast milk. This is special commodity. Okay, so whatever you know that you're going to use, you fill this whatever bag that you're going to use to the level, so nothing is being wasted. So if perhaps for the next day you're going to use this package, you place it below your fridge so it thaws out, and the morning you take it off, place it in warm water, never microwave, never boil breast milk, because it destroys the important components of breast milk. And it can also cause hot spots and burn baby.
I see. So as we come to the end of our show, what would be your final words of advice for women who are about to embark on this journey or who are going through this journey of breastfeeding?
So I'll say to you, mothers, it's doable. Breastfeeding is documented to save lives of the infants, and it is also critical for you as a mother, and also for the nation and for the economy of St. Lucia. Also, I'll say to you, please, if you have any difficulty, we are available. We are available at the wellness centers. We are there to assist you to have a comfortable and enjoyable breastfeeding process, and also encourage your fellow friends to breastfeed. And you may have not breastfed exclusively for your first child or previous children, but you can change it. It can happen, and you can do so. And breastfeeding, of course, is best for your baby. And just to emphasize, and I say this to my patients, who is the center there when it comes to, who is the center? It is a baby. we have the mother, we have the father, we have the grandparents, we have every single person's around. But the baby is the center there, and everyone wants the best for the baby. And what is the best for the baby? Is breast milk.
Thank you so much. Now, I think what I would say to mothers would be to take everything in stride. What I have said to my friends and what I've said to myself is that give everything 6 weeks, because the baby's first year, there's so many changes. The baby that you had 6 weeks ago will not be the baby that you have now. There'll be new things coming up, new things that they learn, new experiences for you as well. As a mother, breast milk is best, and formula is very expensive. I know. So I do hope that you learned a few things here today. Please be reminded, Nigel, I know that you learned a lot and he paid very close attention. And I hope, like Nigel, the men paid attention too, because the women need that support. They do need the support from their partners and from their community. And of course, ladies, know when to reach out to your family nurse practitioner, to your local wellness center. Do remember that universal health coverage is being rolled out in the wellness centers in your community. We have 34 wellness centers in St. Lucia, soon to be 35 with the opening of Larry Shoes. We do hope that you contact your local wellness center, find out when your clinic days are, and as Nurse Judah indicated, you can also walk in. If you get in difficulty, reach out, get some assistance so that you can be your best self for you and for baby. This has been Public Health Insider, PHI, for today. We focused on universal health coverage. You can find out more information on the Ministry of Health page and also universal health coverage page. Next week, we will focus on our other project, which is the St. Jude Hospital reconstruction project, and I know that it will be a very dynamic show as we gear up for the signing ceremony between the governments of St. Lucia and the Saudi government for that funding, that all-important funding. That will be a signing ceremony on the 12th of September, where that will enable the government of St. Lucia to complete the St. Jude Hospital. So thank you for joining us. Look forward to seeing you next week.
Why are you suffering from aches, pains, and illnesses when there's help for you at Health